Whoa, that's a big question, hey? I think the reality is that Western medicine is kind of philosophically bankrupt. And I say that as a doctor. The reason I say it's philosophically bankrupt is because it's a bit like the Borg from Star Trek. It just sucks anything that works into its grasp and uses it. It's done the same with acupuncture. It sucks it all in and said, Chinese don't know anything about acupuncture. What could these primitive idiots know? We know how acupuncture works. And they've just completely ignored what the Chinese have been very consistent. Someone who knows what they're talking about will actually quote books that are 2,000 years old. And the reason they quote those books isn't because they're hopelessly out of date. The reason they quote them is because the Chinese absolutely nailed it 2,000 years ago and they don't need to change anything. Compare that to Western medicine. We're always changing stuff. You've always been told, for instance, to give paracetamol to your kids when they have a fever. Now, we're saying don't. So we're always changing Western medicine. Chinese have always been saying, this is how it works, this is what it does, and this is how you make it work for you. That's why you've got to pay attention to it, because they're consistent. What no one's ever done before, and I suppose what I was uniquely placed to do, because I'm trained in both Western medicine and Chinese medicine, was put the two together and show that actually everything the Chinese talk about in terms of their medicine, we can understand with Western medicine, but we have to go back to the embryology. And that's what I say, no doctors know the embryology. If you start talking to embryology with doctors, they just, you can say any old rubbish. Oh, you don't know anything about acupuncture?
Nothing at all.
That's a good question. Why should you read the book? Okay, because the book isn't really a story of acupuncture, the book is the story of you. So that story of a single cell to 10 trillion cells is just the most fantastical story, you know, ever. What happens in those 12 weeks is kind of 600 million years of evolution in super fast forward, and the body doesn't just, you know, make a tiny little body and then get bigger and bigger and bigger. It actually goes through a stage of frog spawn, and then it goes into an egg, and then from an egg it turns into a little kind of like lizard or wormy type creature, and then it looks like a little mouse, and it keeps growing and growing and growing. And so it's not really a book about acupuncture, it's a book about like how amazing you are, and that's why you should buy it, because you're amazing.
So what's sort of the dream? What's like the next step? Do we do Chinese medicine in hospitals just sort of as standard?
Yeah, well this is the frustrating thing. It's just crazy. It's absolutely crazy. Here's a treatment that's free, safe, patients love it, and you've got nothing to lose, and yet the resistance and inertia within Western medicine to it is just phenomenal. The problem is that patients are losing out. I treat patients in A&E with acupressure, so you can fix all kinds of things with acupressure, and like nosebleeds, asthma, headaches, and it's very simple, and patients love it because, you know, physical touch is one of the most caring things you can do to patients, especially like the elderly patients, you know, who often don't get a lot of affection really in their lives, and yet we don't teach this at medical school, and we're just losing out. We're losing out.
Cool. I can't think of any more questions. It's make me want to go home and hug my nana.
Aww.